Our next topic is Leucorrhoea. It is a frequently asked short note in your examination. You please note the spelling of Leucorrhoea. There are two spelling for this condition. The first one is British English and the second one is American English. So usually we are using the first one, that is the British English, Leucorrhoea. But in Mathematica and Repertory we can see the second spelling, that is the American English, Leukorrhea. Both are same. Regarding the definition, Leucorrhoea is strictly defined as excessive normal vaginal discharge. Excessive normal vaginal discharge. We have seen many infective conditions which causes excessive vaginal discharge, like gonorrhea, chlamydia, trichomoniasis, bacterial vaginosis, moniliasis, etc. All these conditions are with increased vaginal discharge, and the term Leucorrhoea does not include the pathological infections of vagina. Leucorrhoea means simply excessive normal vaginal discharge. So the term Leucorrhoea should fulfill certain criteria. First of all, there will be excess normal vaginal discharge, and the second one is the discharge should be non-purulent, non-offensive, and third point is the discharge should be non-irritant and never causes pruritus, and there will no excess WBC when examined under microscope. So if the vaginal discharge is purulent, offensive or irritant type, that does not include the term Leucorrhoea. Such abnormal vaginal discharge are obviously due to pathological infections of vagina. Before going to discuss about our topic, let us have a quick review about some terminologies. What is vagina, what is cervix, and what is vulva. Vagina is the lowermost part of the internal female genitalia. Vagina is the fibromuscular passage which extends from cervix to the external genitalia. And what is cervix? Cervix is the lowermost part of the uterus that connects uterus to the vagina. Cervix has two parts. The lower part of the cervix is called ectocervix, and this part, the lower part or ectocervix, is bulges into the vagina. Cervix has two opening. One opening opens into the uterus, that is called internal os, and the other opening which opens into the vagina, that is called external os. On speculum examination we can see the external os. Then what is vulva? Vulva is the collective term used for the external female genital organs. The term vulva includes labia majora, labia minora, mons pubis, clitoris, vaginal opening, urinary meatus, and Bartholin's gland. All these parts are collectively known as vulva. Please keep in mind the exact definition of these terminologies. Next, let us see what are the causes of Leucorrhoea. There are mainly three causes for Leucorrhoea. First one is physiological excess, then cervical causes, and vaginal causes. Let us explain one by one. The first and most common cause is physiological excess. Certain physiological conditions are associated with increased normal vaginal discharge. This physiological excess of vaginal discharge occurs when there is increased level of estrogen. This happens in conditions like puberty, during ovulation, during premenstrual phase, during pregnancy, or during sexual excitement. These are the conditions in which there is a physiological excess of normal vaginal discharge. The second cause is cervical causes. Mucus discharge from endocervix increases in certain conditions like cervicitis, cervical erosion, or during ovulation time, or in case of mucus polyp and ectropion. When there is a increased mucus discharge from endocervix, it passes through vagina and it appears on the vulva. On speculum examination, we can see the increased discharge at the external os. So, in order to differentiate whether the increased mucus discharge originated from vagina or cervix, we have to do the speculum examination. Sometimes increased vaginal discharge originates from the vagina itself. It is due to some local conditions in pelvis with increased in blood flow to the pelvic organs. The conditions which increases the pelvic congestion include pregnancy, uterine prolapse, acquired retroverted uterus, pelvic inflammatory diseases, use of oral contraceptive pills, ill health, chronic constipation. These conditions causes some pelvic congestion, and due to this pelvic congestion there will be increased mucus discharge from vagina. We can classify Leucorrhoea into two based on the origin of the secretions, whether the secretion originates from cervix or vagina. Accordingly, there are two types, that is cervical leucorrhea and non-pathogenic vaginal leucorrhea. Next is about diagnosis. Leucorrhea is generally a clinical diagnosis, but we have to rule out other pathological infections of vagina. Diagnosis is possible by proper history taking, physical examination, and speculum examination, bimanual examination, and laboratory investigation. During case taking or during history taking, we have to ask about the nature of discharge, duration of discharge, associated symptoms like dysuria, dyspareunia, pelvic pain, use of oral contraceptive, etc. Proper case taking give valuable clues regarding the diagnosis. Physical examination includes general health assessment, abdominal examination for any mass or tenderness, inspection of vulva for any lesion or ulcer. We know that ill health causes leucorrhea, so general health assessment is necessary. We have to examine the external genitalia to rule out any skin lesions or skin conditions in the vulval region. Speculum examination is carried out to differentiate cervical leucorrhea and vaginal leucorrhea. And bimanual examination give clues about any foreign body. Microscopical examination of cervical and vaginal smear is carried out in order to exclude any pathological infection. Leucorrhea is a clinical diagnosis. From the nature of the vaginal discharge, we can make a diagnosis easily. In order to rule out other pathological infections, we have to do the physical examination and we have to conduct the microscopic examination. Then about the differential diagnosis of leucorrhea, we know the main differential diagnosis is pathological vaginal infections. First of all, we have to rule out any pathological vaginal infections, and the next is neoplasm, and the third one is foreign body. Regarding management of leucorrhea, improvement of general health, we have seen that ill health causes leucorrhea. One of the causes of leucorrhea is ill health, so we have to give directions to improve the general health. Certain cervical factors require surgical treatment, such as cervical polyp. Then treatment of PID, pelvic inflammatory diseases. PID causes vaginal leucorrhea, pelvic congestion, so we have to treat the pelvic inflammatory diseases to cure this leucorrhea. Then physiological leucorrhea, mainly seen during puberty, so we have to give the proper health advice. Most of the time, no need of medical treatment for leucorrhea during puberty. Above all, we have to give directions to improve personal hygiene. Well, these are the management of leucorrhea. Apart from medical treatment. Regarding rubric, there is a direct rubric in our repertory, chapter female genitalia leucorrhoea. This rubric explains both the normal vaginal discharge and abnormal vaginal discharge. So we have to take the same rubric for leucorrhoea and also for pathological vaginal infection. So in repertory, the term leucorrhoea includes both normal and abnormal vaginal discharge. So these are some sub-rubrics given under leucorrhoea that we can take it for increased normal vaginal discharge or absolute leucorrhoea. These rubrics include leucorrhoea albuminous, atoniform, anemia in, bland, blown and phlegmatic women in, cachectic women in, children in, coition after, colorless, daytime, morning, evening, etc. Dreams with amorous, excitement aggravation, exertion aggravation, fright before menarche, lying aggravation, masturbation from, menses before, menses during, menses after, motion aggravation, old people in, pregnancy during, puberty at, rest aggravation, sexual excitement from, sleeplessness after, staining linen, stool after, stool during, aggravation, thin women in, tuberculous women in, urination after, urine like. We can consider all these sub-rubrics for leucorrhoea or for increased normal vaginal discharge.